Jan, nice to see you again. Real pleasure.
Thank
Thanks
you
for
for
joining
having
us here on HealthConnection. Our title here, I like this, colon cancer, preventable, treatable, beatable. That all sounds real good. So let's start off here. What causes colon cancer and who's at greater risk for developing it?
Those are great questions. And I wish I had an answer. We really don't know what causes colon cancer, but we do know that most of the time colon cancer starts from a polyp, which is kind of like a wart on the inside of your colon. People who are at highest risk are people over age 50. If you have an inflammatory bowel disease like Crohn's or colitis, or if you have a family history of colon cancers.
Okay. Are there any obvious early symptoms, or is it most often found at advanced stages?
That's the frustrating part of what we do. Early colon cancer often has no symptoms at all.
Okay.
As it advances, the symptoms depend on the size and location of the cancer in the colon.
If you have waited too long, is there a symptom that you would see, you say, oh my goodness, I need to move quickly? Is there anything you look for that tells you got a problem?
Anytime you have bleeding, anytime you have pain, change in bowel habits, and sometimes not being able to have a bowel movement at all.
Okay. And how and when do we screen for colon cancer?
If you're the average guy on the street, you begin screening at age 50. If you have a parent, brother, or sister with colon cancer, you should start at age 40 or 10 years before your relative developed cancer.
I think you just answered the next question. With a family history of colon cancer, does that change how often and you should get screened and when you should start?
Absolutely. If we already know that you have some risk factors, we're going to watch you more closely. We may start earlier. We may continue screening at shorter intervals to make sure that we watch you and keep you safe.
Diet, is it a risk factor?
Diet's very much a risk factor. There's good studies that show a diet that is high in fat, low in fiber is associated with colon cancer, and there are some studies that are looking at red meat intake as a risk factor.
Besides the two that we just talked about, diet, family history, are there any other risk factors for developing colon cancer?
Yes, and they're the same risk factors that put you at risk for developing other diseases. Sedentary lifestyle, excessive alcohol intake, smoking, obesity, and sometimes just the fact that you're over 50.
The title of this segment is Preventable, Treatable, and Beatable, so let's take those in order. Let's start with prevention. Following the recommended screening guidelines, how preventable is colon cancer?
It is very preventable. If you have your screening colonoscopy and we see a polyp, we can take it right then before it has a chance to develop into a cancer.
So you mentioned, finding a precancerous polyp as opposed to finding cancer.
Mm-hmm.
What does that mean in terms of the treatability?
It's a world of difference. If it's a polyp, we can treat it during the time we're doing the colonoscopy. It can be removed and you may be done. If we find an advanced cancer, you may be facing surgery, chemotherapy, and radiation.
Let's get to beatable. What's the survival rate for advanced colon cancer compared to finding it through early screening?
5-year survival rate for stage 4 cancer is only about 11%. However, if we catch it at stage 1, survival rate's over 90%.
And as opposed to finding a precancerous polyp?
That can be taken care of during a routine colonoscopy.
Very well. Jan, a real pleasure. Thank you.